the world is changing, the lifestyle is changing. So accordingly, signs and symptoms develop. It doesn't mean that a new disease or old disease. I have already told the basic theories in Vata, Pitta, Kapha. This is in old age and also in recent era also. These are the basic elements and concept. It is not changing. So we can analyze each and every condition, each and every signs and symptoms on this basis. Then it becomes old disease. There is no new disease. That means, suppose a patient is saying there is dryness. We can analyze that symptom on the basis of Ayurvedic theory. Then we can say, or I will say, it is Vata dominant. Then becomes very simple. We can handle it as a Vata predominant disease. And treatment for Vata predominant disease are very easy, and it is written in before 5000 years. We can to just adopt it and modify if necessary according for practical implementation according to the present situation. That's all. The disease is not new or not changing. It is there, and it may manifest in different ways. That's all. Anything and everything in this world can be analyzed on the basis of Ayurvedic theory. That is the basis. So any disease can be studied, or we can understand it on this theory. So if a patient comes with a diagnosis, we are saying some new diagnostic terms such as some floaters or diabetic retinopathy or glaucoma, like that, and these are new disease and how it is handled in Ayurveda. That is your question, no? So whether the disease are new or not, the eyes are same, the structures of the eye are same, it is not changing, isn't it? The sclera is sclera, cornea is cornea, or any structure of the eye is not, there is no new structures in the eye. So the functioning factor on that also is the same, Vata, Pitta, Kapha. And according to the new lifestyle or profession or new environments, how these functioning factors, that is Vata, Pitta, Kapha, are developing the symptoms. That is the only problem. So by seeing the changes in that eye, we can understand what is the dominant dosha, what is the defect in that functioning factor. It is very easy. No need of a diagnostic particular term for treatments. And that also may change from time to time. The disease not remaining as such from the beginning to the end. The symptoms are changing. Whether it is glaucoma or dryness, whatever it may be, it is not remaining as such. From the very beginning, there will be, for example, dryness. The patient may be feeling some dry feeling and lack of some fluid, like that. Later, it may develop to more serious condition, and not able to look at bright light, or there will be roughness in the eyes and hard foreign body like feeling in the eye, and later blurring of vision, like that it changes. But the term this disease, that is dryness, is remaining. Then what does it mean? In Ayurveda, if the symptoms are changing, if the patient is feeling different symptoms, then the functioning factor will be different. The treatment also will vary. Then what is the importance of actually a particular diagnostic term? If the symptoms varies, if the treatment varies, then we can change the diagnostic term also. We can we can introduce any new diagnostic term. So we are depending on the signs and symptoms and there is a causative factor behind that, and accordingly we can manage it. This is applicable in any eye disease. So it is not a new thing. We need not be afraid of it. Whether sometimes a new disease will come again, tomorrow new term will be introduced. So what? eye is same, the function of the eye also is the same, and the functioning factor behind also, that also is the same, and the symptoms developed will be different, and that symptoms can be analyzed on the basis of these factors, and then we can manage. That's all, no problem in handling such a case.